And I know from my clinical practice, I've been using Locator for, 14 years now. Locator is effective. It's easy. It's durable. It's self-saline, and it has a very low clinical profile. The minimum height is 3.2 millimeters. The actual housing is somewhere right around 1.2, and the attachment, the actual part in the implant, the minimum is about 2 millimeters. So the two of them come together, you need a bare minimum of 3.2, which is almost nothing. The height of the locator really allows you to be incredibly versatile with your overdenture restorations. Now, of course, the big negative, nylon wear. That's true of so many things in implant dentistry, but the nylon wear can be an issue. If the patient bites down just a little bit goofy with locator, once it bends, you have to replace the insert. The reports over and over and over again show that locator is an incredible restoration that's chosen worldwide and here in the country is incredible results. Now, how does the locator actually function? Let's take the locator, split it in half. Essentially, this little pink part that goes over the top of the locator is rigidly attached to the top of the locator. When the patient moves side to side, that top cap moves with the denture. The pink part, or the blue part, the nylon part, stays rigidly attached to the locator assembly itself. And that's very, very important to understand because other attachment systems out there cannot function like this because this is a patent pending design, or patented design, excuse me. Now, this is important as well because we know that it helps minimize the chance of wear occurring in the most important part, which is in this part right in here. And this part right in here. You have dual retention. This part is snapping as well as this outside part is snapping. The combination of the two of those allows you to have dual retention, helps to minimize dislodgement of the locator assembly during function. Now, the Zest company allows you to have two different types of angulation components for the original locator design. You have up to 20 degrees of divergency allotment for the traditional normal range male inserts, and then you also have these extended range male inserts, which will allow you up to 40 degrees of divergency. The extended range is only different in the capacity is it doesn't have that little internal button, where these have this little internal button right in here, the dual range. The extended range only snaps on the outside. That allows for greater divergency in off-axis situations. Now, when it comes to locator, you have three different retention levels for either standard range or angled or extended range. Blue is the lightest, pink is the medium, and clear is the heaviest, the most retention. When it comes to the angled, red is the lightest, then the medium is orange, followed by the green as the most retentive. Some of you also may be aware that they make a zero retention insert for locator, and also that works in situations where you're working with 4 to 6 implants, potentially more, where you might want to go ahead and just use one of the implants for support instead of retention. Additionally, in really tricky situations, they also make a purple insert for the standard range. You just have to call up Zest Anchors and ask for that. It's super retentive for those especially challenging cases.